Congratulations on using your new high-pressure saline exfoliation system. This video guide will show you how to use this system correctly and how to educate your clients in order to get the best results. Unlike traditional microdermabrasion, there are no contraindications for the use of the high-pressure saline treatments. It's safe, easy to use, and costs very little to operate. In addition, there are many post-treatment applications that can be used. There are no correct starting or ending points with the use of the high-pressure saline treatment. This guide will show you our recommendations. Each treatment should progressively increase, and you should space your treatments approximately 1 to 2 weeks apart. Each treatment should be progressively increased by increasing the number of passes that you apply to the treatment area. It is critical that you hold the treatment handpiece as close to the skin without touching it as possible. Even a few centimeters away from the skin makes the treatment ineffective. Areas of the head and neck that have thinner tissue, such as under the eye and the neck, require an increased distance away from the treatment area in order to accommodate for their thin tissue. Here are some things to tell your client prior to their first treatment. Their skin will get cold, uncomfortably cold. This is due to the pressure drop between the end of the handpiece and the surface of the skin. Many clients will have difficulty breathing on their first treatment because their mouth is closed. If they feel short of breath, they simply need to breathe through their mouth. Saline is a very safe product to use when exfoliating the skin. It hydrates immediately. However, it doesn't feel so good when you point that handpiece over the ears or up the nose. Let's take you through a typical treatment with a high-pressure saline exfoliation. The face should be cleansed prior to the start of the treatment. We like to start on the forehead. On a first treatment, every client should get 2 passes approximately 90 degrees to each other. You can start anywhere on the face and do a single pass over the entire face and come back and do a second pass at approximately 90 degrees. Keep the handpiece as close to the skin as you possibly can. Unlike traditional microdermabrasion, the high-pressure saline exfoliation can be done all the way into the scalp and through facial hair. During the course of treating the face, it's always easier to work with the client's face on a horizontal position to the treatment tip. Working on the forehead area and the temple area is relatively easy because the skin doesn't get pushed away from the end of the tip. When you're working on the mid-face, the skin is pushed away from the end of the handpiece due to the laxity of the skin. Make sure that you either hold the skin taut with your non-handpiece hand or follow the skin as it gets pushed away from the end of the tip during the treatment. When working under the eyes, be sure to leave a little more distance from the handpiece due to the thinness of the tissue. When working around the nasal area, you may want to remind your client to breathe through their mouth if they feel short of breath. Blackheads and extractions can be treated simply by focusing on an area and changing the angle of the handpiece just slightly, and the blackhead will pop out. Working around the outer corner of the eye will hydrate the area and fill those fine lines and wrinkles. Working the upper lip can also decrease the fine lines and wrinkles. Be careful not to point the angle of the handpiece up the nose. And finally, finish off the treatment by doing the neck in 2 passes approximately 90 degrees to each other. Optimal performance of your system can be obtained by changing the handpiece on a regular basis. As the salt water evaporates, salt crystals are left in the tiny openings of the jet handpiece. Replacement handpieces can be obtained from Grace Medical Equipment. Longevity of your handpieces can also be lengthened by flushing them with distilled water. A huge benefit to your client is to use corrective serums with the device to infuse the product to the therapeutic level. Contact us directly in order to obtain these serums and to get further instruction on their usage.